Good morning, everybody. Good morning. We're doing our presentation on adhesive disc interventions. My name is Emery McIntosh and my partner,
Tia Smith.
Okay, so our objectives today are to discuss the problems associated with adhesive disc interventions, identifying supporting interventions to address the problems, and explain how supporting interventions may address these problems. So some of our impairments slash dysfunction that we're going to discuss are restricted movement, TMJ discomfort, aggravation, and pressure-induced tissue damage, all of which can be caused by some sort of tautness in the musculature around the TMJ. So we're going to get into some interventions to address restricted movement. So for the max protection phase, I'm going to have my patient seated here. So firstly, what I'm going to have her do is what we call the goldfish exercise. So I'm going to have her keep her tongue on the roof of her mouth while having both her fingers around the TMJ, and you're going to work on opening. This is good for increasing range of motion and allowing slack on the joint. So this is good for the maximum protection phase. It also improves mobility, and like I said earlier, allows the dog to relax. So for the moderate protection phase, we want to incorporate some stretching of the temporalis and masseter muscle. Can I have you laying supine, please? So the temporalis and masseter muscle are both responsible for elevation of the mandible. The only difference is the temporalis is responsible for retraction, and the masseter is responsible for protrusion. So to stretch this muscle, scoot down a little bit more. No, a little bit closer to me.
Oh Lord, my tag got stuck. Sorry.
So to stretch the temporalis, I'm going to have my patient protrude the jaw while I depress the mandible. She should feel that stretch up here.
Yeah.
Now to stretch the masseter, I'm going to have my patient retract the jaw while I depress. And she should feel that stretch here in this muscle. And this is good to relieve pain, it relaxes the muscle, and also improves jaw function. So getting into our minimum protection phase, we wanted to work on eccentric strengthening of the masseter and temporalis. So in doing this, you can have you sit up.
Okay.
In doing this, we're gonna work on some restricted jaw opening. This eccentrically strengthens the muscles here as their primary action. Yes, as the primary action is to elevate the mandible. So we would do about 2 sets, 5 to 10 reps each, just working on this strengthening here as it allows for more flexible mobility. Good. So now we're going to get into some TMJ discomfort and aggravation.
To address discomfort and aggravation, we're going to do a massage of the masseter and temporalis muscles to help them relax. If they're taut, they may cause discomfort to the patient. So, yes, take off your glasses, please. I'm going to find the zygomatic arch, go like a teeny bit above his ears, and then go down. And then just perform circular motions down the muscle. It should feel very relaxing to the patient.
It does.
Great. Let him just want to find his temples and just apply fun little circles to relax his muscles. Great. And then next we're going to do an anterior glide with grades 1 through 2, oscillation for pain modulation, and this should reduce myofascial pain and contractile tension. Well, I guess 3 through 4 decrease contractile tension. So I guess we're going to go to 1 through 2, and then 3, 4. Yes. Okay, great. I want to raise him up a little bit. Okay, so I'm going to take my thumb, have him open his mouth, and place it behind his incisors and the forward bottom teeth. And then he has, well, okay, so it's not supposed to go like directly on the teeth, I don't think. And he also has a permanent retainer. So I would say to be very cautious about the metal that they may have in their mouth. And I'm going to grip and then have my finger on the bottom of his chin. And then I'm going to pull anteriorly and just oscillate here. Is that okay?
Mm-hmm.
And then I'm going to go deeper and oscillate here. Deep full separation.
Mm-hmm.
Okay, great. And relax. Okay. And then last we're going to do some resistant jaw opening. This should be good for strengthening the muscles around the TMJ, so hopefully we can eradicate the discomfort that he was once feeling. So I'm going to have him open his mouth against resistance. Good. Relax. Okay, open mouth. Okay, good. A little shaky. And then we're going to have him protrude his chin against resistance this way. So protrude. Good. And relax. Protrude. And relax. Great. And then we're going to have him do lateral excursions. So we're going to have over here by his mandible kind of. And then have him push it out towards his finger. And he's going to apply resistance in towards his head. And then we're going to do the same thing on the other side. And then I also wanted to incorporate resisted jaw closing too, to get all of the areas of the way that the jaw moves. So if you open your mouth and then place your fingers inside of the mouth. Okay, try to close against resistance. Pull down. Close your jaw, pull down with your fingers. Good. Relax. Goes down. Good. Yes.
Okay, so we're gonna talk about pressure-induced tissue damage. So for our first exercise in the maximum protection phase, we wanted to work on some trigger point release along with a massage of the temporalis, masseter, and buccinator. So for our trigger point release, I'm gonna have my patient lying in the supine position. And trigger point releases are good to relieve myofascial pain, improve circulation, and also increase jaw mobility. So what I'm gonna do is, I'm gonna have you slightly open, have my finger here on the inner lining of her mouth, and with my thumb, I'm just going to palpate for any sort of trigger points, any sort of tightness, tautness, or puffiness that I feel. And once I find that point, I would just apply a light pressure to it. And if you were to feel a larger pressure point, you could apply more pressure. And you basically just want to smooth it out, eliminate any sort of tightness that may be causing any restriction here.
For the release. And then do the other side. Wait for a release.
Oh, for a release.
And then do the other side.
And you can also make your way down, move to new sites to also find that release there. Now,
Also going to incorporate a massage of the temporalis and masseter.
so kind of what Tia mentioned earlier, just want to start here at the temporalis, go in a circular motion, because if these muscles are experiencing any tautness, it can make its way down and cause restriction. So we start here in the temporalis, go down the zygomatic arch to the masseter. And can I have you clench your jaw? So this confirms that this is the buccinator. So I'm gonna also get into this area.
So for our moderate protection phase, we wanted to also incorporate some stretching of the specific muscles, temporalis, SCM, buccinator, and masseter. So can I be laying back down?
Okay.
Stretch the temporalis muscle. Pretty much what we did earlier, just gonna have her protrude while I apply a downward resistance. She's gonna feel that stretch there. And this also stretches the masseter. Now, to stretch the SCM, I have you scooting a little more back.
Towards you.
I'm gonna have my patient, if I'm stretching the left SCM, I'm gonna have my patient side bend to the right and also laterally rotate. Rotate to the right. This is gonna apply a stretch here. If I'm stretching the right SCM, I'm gonna have her laterally rotate, or stretching the right SCM, I'm gonna have her laterally rotate to the left and then rotate to the right. And you can see because it protrudes out here, and that applies a greater stretch there. So we also wanted to incorporate a distraction, a grade 3 or 4 distraction to incorporate mechanical effects to improve range of motion. So I'm just going to provide a distraction of the mandible here. I'm gonna have her open her mouth, place my thumb here on the inner line near her incisors, and I'm just stabilizing here on her forehead and just applying a downward force. Feel that separation.
Mm-hmm.
This is good. Some patients may enjoy this movement, as when you're applying a distraction, it allows the fibers to temporarily repair themselves, which is good for recovery. And for the minimum protection phase, just want to incorporate some more eccentric strengthening. I believe eccentric strengthening is important because it'll allow for natural motion. We preferred this over concentric strengthening because we believe that concentric may be a little too aggressive, especially for pressure-induced patients. So just going to have her do some restricted opening again. Well, this removes the glasses.
Yeah.
Just gonna have her do some restricted opening. Want to make sure the band is directly under the jaw here, so it can apply good resistance. Then we can also incorporate some resisted closing. So I'm just gonna have you put your thumbs in your mouth, open and push up while you're trying to close. One more time. Good. And then lastly, just to incorporate some eccentric strengthening of the SCM. So we're just gonna have some, just gonna have some resisted extension. Have some resistance extension since it's responsible for flexion. also incorporate kind of like a towel technique, a towel stretch. And just wrap it around your head there. Now you're going to push to the left with your towel, but rotate to the right with your head. This works on strengthening this left SCM here, and then if you replace it and put it on the other side, do rotation to the left while applying your force to the right. That works on strengthening the right SCM here. And we would hold about 10-15 seconds or so for about 2 to 3 repetitions. These are our references. Are there any questions?
I believe I missed it, but what is the significance for the SCM and team day?
So we believe that muscle is important as it's responsible for many movements in the area. So it's responsible for flexion, lateral flexion, and rotation. So we believe if that muscle is taught, it can limit or put a lot of unnecessary excess pressure on the TMJ there, which can cause like restricted jaw movements like locked jaw and other things.
Yes, Kendall.
Could y'all tell me like another abnormality of the TMJ besides the restriction, the intracapsular restriction?
Yes, we can. I found something very fascinating in Dutton actually. So in Dutton, another abnormality that's likely to form would also be an articular adhesion. So the difference between an intracapsular restriction and a articular adhesion is the intracapsular restriction results in a limitation of movement in the joint capsule specifically, and an intra-articular adhesion describes fibrous bands of tissue forming in the joint space, which essentially stick the structures together.
Any other questions? Yes, Gabby.
Could there be any, like, I guess, adhesions in the cervical fascia that could be contributed to TMJ? Or did you see anything?
I didn't see anything, but I feel like it would be likely that cervical adhesions could affect the TMJ.
Are you referring to like muscles specifically, or?
Just like the fascia.
I know, yeah, you did talk about the SCM, but I guess, you did talk about that.
Yeah, maybe like the muscles that open the
Yeah, I was thinking about
jaw.
that.
Yeah.
I noticed when you were doing the interventions, you kept saying like protrusion or the other word. Retraction, thank you. How would you describe that in a way that your patient will understand versus saying those words?
I would say for retrusion be like move your jaw back to your neck if you can.
Or retraction.
For retraction, yeah. And then for protrusion, I just say move your jaw or move your bottom jaw out towards the sky, or like out towards me.
It's essentially moving your jaw forward and moving it backwards.
Thank you.
I grabbed these dumbbells real quick.
Take them all now, man.
Well, it's not, they can't look down now.
Any other questions?
Okay,
Yes.
so go back to the beginning. I'm gonna point out some things. So when we're working with the TMJ, and when we're doing manual techniques, and when I'm talking about TMJ invasive, when we have to put our thumb or finger in the mouth, we wanna be very cautious and systematic in our approach. I know I just discharged a TMJ patient on my caseload, and I did invasive manual joint molds on her throughout the time frame. And so when I did all those joint molds, I did them, I did the soft tissue work first. And I had on a pair of gloves with the soft tissue work because I was working on soft tissue external. I took those gloves off, and then I put on a new set of gloves when I got invasive. Everything that I did invasive, I did with those gloves on. I didn't touch anything else. Then when I was done doing those techniques invasive, I took off those gloves, threw those gloves away. So you don't want to go back and forth with your manual with the same set of gloves on. So I noticed you did a whole lot with those gloves externally. Then you went back and did some internal things with those gloves. So she was a patient that didn't put up a fuss about that, but most patients are paying attention to things like that. So you just want to be cognitive of that. That was just like like a technical professionalism type of feedback that I have for you. Now, all right, go to the next slide. I'm fine with that slide. That was good. Keep going. All right, and then go back right there. So, now, this is just me. I don't know, you can take it how you want to take it. As a physical therapist, I tend not to use the verbiage massage. I tend to say soft tissue mobilization or soft tissue manipulation, because I'm mobilizing soft tissue and moving soft tissue structures. So that's the terminology I use as a PT. Also, when I build soft tissue mobilization and manipulation under manual therapy, and I don't build out massage. I don't ever build out massage. Some therapists may, I don't. And also, we want to distinguish ourselves from massage therapists, and patients can tend to think that if we use the term massage, they say, oh, I can go to the physical therapist and get a massage. I'm not about to give you a massage as a physical therapist. I'm gonna do some soft tissue, some specific soft tissue techniques that are gonna be aimed specifically at generating a therapeutic effect for whatever specific muscle. So I'm not about to be doing general type of massage on you. I'm just letting you know right now, I'm a PT and I'm distinguishing myself from a massage therapist. Does that make sense? So I would probably say masseter and temporalis, STM, soft tissue mobilization or manipulation. You see? But there's just an FYI in the future, because I'm gonna let you know how patients think. Even the general population, oh, I'm a PT. Oh, I can come to you and get a massage? No. I'm telling you this is how I actually respond to those people. I say, no, I don't do it. You have to go to a massage therapist if you want a massage. Because that's how you break the barriers. We've gone to school way longer than a massage therapist. You see? Our education is way more in depth than a massage therapist. Not to downrate a massage therapist. Massage therapists have their role. Everybody has their role in what we do. But I don't want physical therapy to be correlated with massage therapy. So I stay away from the term massage. But that's just a FYI pointer for you all to grow on. All right, keep going. Okay. All right, keep going. No problem. That's good information. Keep going. Okay. Now, SEM stretch. Did I go over that?
You did.
I did.
You did.
How to specifically stretch it, right?
You did.
I did.
You did.
Go ahead, go over it.
Okay, I think.
Hemorrhage the patient, you be the
Okay.
therapist.
Let's sit down. Lay on your back. So you wanna laterally bend and then
So-
twist your head to the side. That's elongated. And you should go stretch right here.
Okay, go, let's just, you do it, don't be afraid, use your hand. So take them to right side bending,
Okay,
so you got the motions down, yeah, get them far as you can get them.
okay.
Flex them a little bit, there you go, cause it's gone. Then rotate them to the left, I see him wincing,
You okay?
it could be tight.
Okay, we'll stay right here.
Now you got a greater stretch on the left SCM.
Yeah.
So side being right, that's good,
Mhm.
and rotate left, just stretch to the left SCM.
Mhm.
Very good, Tim. So Emory was
That's good.
saying some stuff, but when Emory was saying it, I zoned it out. I heard it, and once I heard it, and then I said, cause I know I went over that and taught that differently. Okay. So to specifically stress the MCM, make sure we got that down. That's gonna come back at you. You're gonna see that again, right? Devonna, to specifically stretch the SCM, what do you need to do to stretch the left SCM? Mm-hmm. Stand up. Do 10 calf raises. Get some blood going to the brain. There you go. Keep going. Keep going. Keep going. Keep going. Keep going. It's method to the madness. I do this with my athletes when they zoning out. I say, go ahead and do some, what I call them. My mind going blank. I need to do something too. But I tell them, go ahead and do some push-ups or something. I get them to do something.
Isn't that the stretch that Tish performed with the left SCM stretching it?
So what do you have the patient do?
Side bend to the right and flex and rotate to the left.
Okay, good. So you can introduce flexion to start, but if you, it doesn't matter, but as long as you side being right, rotate left. You're stretching the left SCM, and it's good to incorporate some flexion with that. Good. Those heel raises, they help, didn't they?
Nerves and lock in.
Yeah, like your heel raises help you lock in. That's what I do with my athletes. Oh, that's what I tell them to do. I say, give me 10 burpees. So when they zone out, they not paying attention. I say, give me 10 burpees. Even my higher skill level athletes, one of my higher skill level athletes, Rico, he love to zone out. He think he already know what I'm doing. Think he already knows. I go, Rico, 10 burpees. Good. We got that. Kentoria, to stretch the right SCM, what do I need to do? There you go. Good. All right. Next slide. Next one.